is back. Well, not officially, but we're getting close. So you may be out for a run, maybe you're going out for a bike, perhaps one of your favorite hobbies happens to be a sport that's physical. You may need sports rehab. Let's talk about that a little bit with Dr. Josh Bixler. And you've got so many letters behind your name, man. Yeah, you're well accomplished. So welcome to the show.
Thanks, John.
He is with KORT Physical Therapy. KORT Physical Therapy, don't forget it. That's Kentucky Orthopedic Rehab Team, correct?
Correct.
All right, Dr. Bixler. First of all, there's a misconception out there, I think, that when you think about sports rehab, I tend to think, and a lot of us do, I think that, hey, it's for professional athletes or people that are in a competitive sport. Not completely true, right?
Not true at all. Actually, our definition of an athlete spans the entire age spectrum. So whether you're 10 or 70, anywhere in between, if you want to be active, this program's for you.
I'm curious. I would think, though, that everything that happens on a professional level has a positive trickle-down effect, because you have all these, teams, professional teams that spend millions of dollars to make sure they can get these athletes back on the court. And at KORT, you guys have the ability to use that technology to help people like me, get back to an active lifestyle, right?
Absolutely. It's really about meeting where you're at. So your competition level, are you 10, are you 15, are you a professional athlete, or are you 70 and just want to continue to be active? And the technology that we have helps us make decisions on how do you know you're ready to go back to sport? How do you know your strength's there? How do you know that when you're running and jumping, that those mechanics are the way that we want them to look? And the technology that we have access to is something that separates us.
Fantastic. So what's the difference between sports rehab and I guess traditional physical therapy? What's the difference between the two?
Sure. So in previous guests, we've talked about the power program, the pelvic health program, the cancer. The sports program, it's much similar. So what you're going to get access to is very tailored protocols, systems, progressions of exercise, systems to get you back to your sport that general physical therapy is just not typically going to have access to. And it's going to help you get back to your sport or hobby much, much quicker.
So Dr. Bixler, for those who are watching now and saying, well, this is for younger people, but so I guess how do you qualify it as sports rehab? Is it all about physical movement? What makes it, to me, sports rehab sounds like it's a little bit elevated. But it still applies to old folks, you said.
Absolutely. So most people, when they think of physical therapy, they think of coming to us with pain.
Right.
Pain is one piece of the puzzle. We also have to consider your range of motion, your strength, your power, and we work on all those qualities to then get you back to it. So it's really just meeting you where you're at, what you've had previous exposure to from an exercise standpoint, and then we build from there.
Maybe you can tell me, Dr. Bixler, about some unique therapies or something that you're excited about, maybe a type of rehab that you've noticed has made a significant difference, something new on the scene, I guess is what I'm looking for.
Yeah, it's always emerging. So it's really coming out cognitive therapy. So we've always focused on the physical side of the athlete, but what about the mental side? What about their reaction? Sometimes what we're starting to see with these injuries, the brain's involved. So how does the brain process information? And now with some of the emerging technologies with reaction type devices, we're also able to tap into that as well.
Wow, this is, to me, really interesting. So do you need, if someone wants to go to KORT, do they need to have a physician, recommend and direct them that way, or can they go straight into KORT and make an appointment?
They can come straight to see us. Okay. And it's a two-way street. So some folks see a physician, they come to us. Other times come to us, and if it's something that we need to refer out, we'll gladly do so. But most of the times we're able to handle most of the issues. When
you guys come in here, Dr. Bixler, people with KORT, I get really excited about the fact that back as little as 10, 15 years ago, if you had something like a meniscus problem or maybe a torn Achilles, whatever the case, it was surgery, automatic.
Yeah.
Things are getting better now. We have found the body can heal itself with proper therapy, right?
Correct, yeah. And it's really just the education piece, right? And then having certain expectations, laying out a roadmap, what should you expect, what kind of progress should you expect. And sometimes it doesn't work out. But a lot of the times what we're seeing between education and a structured program, we're able to get you back to your goals.
So, Dr. Bixler, do you work hand in hand with maybe an orthopedic surgeon at times? And perhaps, I would guess, orthopedic surgeons, I would think they would be really happy to partner with you because you can actually help the patient, and then that's what it's all about, a better outcome, right?
Absolutely. It's patient-centered. It's all about putting the patient in the center, and we're the eyes and the ears for the physician. No one gets as much exposure to the patient as we do, and so we're going to be with the patient a handful of times a week, and we're going to relay that information back to the surgeon. Hey, this is what we're seeing. I think they're ready. I don't think they're ready, so we can have a complete process for that patient.
So I'm curious about what kind of injuries you're seeing now, Dr. Bixler. I think a lot of us get a little overzealous, get excited about the warm weather, and maybe you go a little bit too hard or get out there on the pavement. What are you seeing right now?
Right now, it's going to be our runners with KDF, right? And then the folks get back into golf. Some of the older folks getting back. And then let's not forget our youth athletes with baseball. You know, they've had winter, they maybe haven't been throwing. Now they're ramping that back up. And so baseball athletes with elbow and shoulder issues.
You know, I don't think it's a reach to say that when we see athletes like the Tom Bradys of the world, LeBron James of the world, who are playing at a very high level at an older age, I think a lot of it is sports physical therapy, right?
Yeah, it's the way they take care of their body, both the mental and physical side of things. It's the commitment to the process, the sleep, the diet, and then the training that's involved with it.
So do you see anything on the horizon that you're excited about, Dr. Bixler? Whenever I see someone like you in the medical field, I always go, okay, maybe there's something that's coming that's going to really make a difference. Do you see a game changer on the horizon?
Yeah, I think virtual reality and VR and using that as part of the rehab process in addition to some of the normal things that we may do with you as a way to keep you engaged with your sport when maybe you still have a sling on. And so I think VR is coming. That'll be something on the horizon.
Okay, so locations. I'm curious, where do you practice out of, Dr. Bixler?
We've got a brand new location on Westport Road, 9451 Westport Road, right there with the Norton Sports Performance Facility, and so that's where we're moving to. But KORT has locations all across, but you can reach us at KORT.com, and but I'm specifically at the Westport Road location.
Okay. One last question for you. Okay, if you had one recommendation to make for people who are getting ready for the mini marathon or the full-fledged marathon, what would you say?
Continue to build up.
Okay.
And then if you're having any aches and pains, don't wait, come see us.
There you go. All right, Dr. Josh Bixler once again with KORT. And again, make an appointment if you have a shoulder problem, perhaps due to golf, knee problems, hip problems, whatever the case may be. You may not need surgery thanks to KORT and Dr. Bixler. Thank you so much.
Thanks,
All right, we're going to take a little break, and then Myra Ansari will join me. She's going to be filling in for Don G today at 2.